Greetings and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Stephen Schultz, State Director of Advocacy and Access for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 victories across the country since 2014, including the new law on step therapy in Colorado. But what do those victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that the patients in your state know their rights. These include providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in Colorado that was fully implemented in 2017 in September, and what to do if you feel the law has been violated. First, let's define step therapy. Step therapy is the protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and medically appropriate for that patient are covered by a health plan insurer. We have had an amazing set of champions in the Colorado legislature on step therapy. A huge thank you to each of those legislators, including Senator Nancy Todd. So what are your rights? Now that there is a law in Colorado on step therapy, we want to make sure you know what that means. The law ensures that health insurance carriers shall not require a patient to go through step therapy protocols for a drug on their formulary if on the patient's current or former health plan or insurer the patient discontinued use of that drug because one of the following: lack of efficacy or effectiveness, diminished effect, or an adverse reaction. So who is covered by this law? Who benefits from this new law? Patients who have individual or fully insured group health insurance coverage will benefit from these new protections. The new law does not apply to Medicare, Medicaid fee-for-service, or self-insured plans, which are exempted by the Federal Employee Retirement Income Security Act of 1974. You may have heard it called ERISA. To learn if you are covered, contact your insurer and provide your policy number. So, what if your prescription is denied? If the medication is denied because of step therapy, your insurance won't cover that prescription. At this point, you may want to talk to your pharmacist and healthcare provider about alternatives that would be covered. You can also decide to pay out of pocket and compare discount cards, cash prices, and assistant programs to determine what works best for you. Now you may go through the appeals process to get on the medication that was denied. So beginning that appeals process, ask your pharmacist what they heard from the insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. And then call your insurance company Find out how to appeal the decision. Your physician often needs to intervene and write a letter. And then lastly, share copies of any insurance letters information you receive with your doctor. Make sure you stay on the same page with them. Now, working with your insurance company. Check with your human resources officer to learn the specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call the company, find out why your medication did not receive approval. The number to call should be on your insurance card. And then lastly, find out if the appeal needs to be online or if there is another process from your insurer. Continuing on the working with your insurance company, keep notes of all conversations, who you spoke with, dates, times of calls, case reference numbers. Have good records, and that will help you move the calls forward. Stay in touch with your doctor through the process and share that information. Your insurance company must provide the reason for your denial in writing. Ask about if you have not received anything from them. If submitting an appeal yourself, include all relevant documents that may help your case. Letters of support from physicians, test results, your personal narrative. Tell your story. And then what do you do if your insurance company is not compliant? If your insurance company is not compliant, here is the website and phone number for the Colorado Division of Insurance. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy website. If you have any additional coverage questions, we encourage you to visit your coverage and care through Prescription for Access. This go-to resource will help you better understand health coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claim denial process. The kit includes information, tips, and tools for consumers to get the most of their coverage and avoid or minimize claim denials. The kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeals process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially the most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar, as we want to make sure that the new laws are being implemented fully so patients can enjoy their new protections.